Hi, we're here with Dr. Frank Chow, psychiatrist, and in this video tutorial we're going to be talking about PTSD and understanding the impact that it can have on a claim. Welcome, Dr. Chow.
Thanks for having me.
You're welcome. So let's start by getting an understanding firstly of what is PTSD.
In short, PTSD is a type of anxiety disorder usually developed after being exposed to traumatic events. Obviously, traumatic events can be classified very differently to many different people, but according to the diagnostic criteria, it has to be quite a severe traumatic situations. However, it can either be direct, indirectly exposed, or being exposed to material related to traumatic incidents as well. So they have a number of different symptoms usually, and most of them are classified into a couple of groups, including avoidance, re-exposure with intrusive symptoms, and also negative alterations in cognition and mood, very commonly related to the depressed mood and anxiety symptoms, and also the hyperarousal symptoms and reactivities to the surrounding and triggers that remind them of the traumatic events as well. Often the differentiation between just some nightmares and flashbacks and anxiety, the individual have to have quite significant distress and impairments to their life in a number of areas of their, including social, occupational, and relationship.
Okay, so thank you for that. There's lots of different symptoms that can manifest and understandably can impact on an individual's ability to carry out activities of daily living. How can PTSD manifest differently between, say, somebody who's a victim or injured in a car accident, as opposed to somebody who's potentially a first responder, like a police officer or an amber or a fiery?
Yeah, so that is a very interesting question. Obviously, from my clinical experience, but also from my number of medico-legal assessment over the years, they both present differently, and their PTSD develop very differently as well. So the first category here is a direct impact from a car accident. So it's quite clearly there's a distinct event causing the reactions. Now, even though with PTSD from a car accident, it can still be manifest in a delayed fashion. So sometimes in a more psychologically minded individual, maybe they can complain about their difficulties early on, but a lot of the not so psychological minded individual, they might manifest more pain before eventually the PTSD diagnosis are being explored or considered, because the pain conditions has just been prolonged without a good explanation. Certain populations with pre-existing issues is also prone to PTSD as well. However, now the second category will be more tricky. Often you would ask, a frontline persons, doctor, nurses, police, fire brigade, veterans. They've been around doing the same jobs for so many years. They have developed the level of desensitization to events. Why some individuals still develop PTSD? There's a few ways to conceptualizing the development, but also it's very important to have a very good history taking to understand the journey of the individual, how they develop the condition. Some individuals develop desensitizations through repeated exposure to events. However, they then develop a maladaptive coping mechanism to cope with that, and it over time reduce their resilience to cope with the same exposure over time. Not uncommonly, there might be events that occur very late to the career that is very close to home, like could be happening to the individual who is reminding of their children, or reminding of family, reminding of themselves, and that develop some kind of fears, and together with some anxiety related to their own performance, it just and the reduced resilience, it kind of take a toll on the individual and develop the PTSD. But with all this career or occupational type of PTSD in a long-term career type of occupations, their presentation can be also very confusing. That's because often they develop comorbidity, and therefore they present with comorbidity first before you find out there's a PTSD at the end. So for example, they might present with alcohol abuse or alcohol dependence, and therefore you see that, you know, behavioral disturbances in the workplace because of alcohol drinking. And then, you know, they might have interpersonal difficulties at workplace because of their irritabilities and more controlling and recurrent outbursts as per the PTSD developing, and causes more interpersonal difficulty and problem. And so they also develop major depressive disorder, and all of those things can cover up and kind of deviate the focus of the individual developing PTSD. It's not until they actually settle down with a therapist for a while and then kind of get better with the alcohol and the depression, then they realize they have an underlying PTSD develop. Because the PTSD does affect the individual in many different ways in terms of biological. They develop alcohol, they develop depression on a biological level, but behaviorally they develop irritability, aggressions, more controlling behavior, and therefore people who work around them can find it very difficult. And sometimes, as they're not able to manage the interpersonal difficulties, they become more irritable and aggressive in the workplace, and get into trouble that way. So often you can have a delayed diagnosis and a delayed onset because of the maladaptive coping mechanism, but also other comorbidity being covered up in affecting how you discover the PTSD. Now, the last bit I want to cover here is sometimes if people develop PTSD, they are not that psychologically minded, and therefore often they don't understand why they're anxious, why they develop this anxiety, sleeping disturbance. And when you don't understand what is causing these feelings, you develop a bigger fears and a bigger anxiety that you started to get worried about all sorts of surrounding and people. And so the anxiety, I often hear the anxiety getting worse over time, and then the hypervigilance becomes much more severe as well. And often people go off work initially with just a little bit of, mild to moderate PTSD, but unfortunately, if they don't get the right treatment and the treatment has not been successful, they later on develop more severe picture, and also the comorbidity sets in as well. Then the alcohol and the depression. So it can actually occur both ways, where the depression, anxiety present first, and then you found to have PTSD, or people might have PTSD symptoms or the actual disorder, but then as they get worse, they develop alcohol and depression as well. So it can be quite tricky diagnosing, treating, and assessing PTSD claim.
For sure. Is there a usual time frame in which PTSD may seem to become apparent after a traumatic event?
Yeah, so often it's quite common the individual will develop some symptoms after the traumatic events, and that's the most common picture, where the event occur and you start to have a lot of flashback and nightmares early on in the first couple of weeks, and if it's settled before a month, we call it acute stress disorder. But if you go beyond a month and lasting the following 6 months or so with significant impact, we call it post-traumatic stress disorder. However, I already covered the prospect of delay onset, and there could be a number of reasons. It could be the individual has been preoccupied with pain and physical injury first, and therefore there has been a lack of focus on the psychological contribution of the presentation. Often this is quite rare though, but it's not necessarily uncommon in the veterans population, is some individual with PTSD develop compensatory coping mechanism that can allow them to cope with their ongoing symptom, but still able to function in a suboptimal level. And the reason being is that they are able to either live in a very defined manner, in a very avoidant kind of manner, like they have very control in who they interact, who they see, where they live, you know, and therefore they live in a very restricted avoidance manner, or they continue to use substances to dampen down the overreactivities of the brain and anxiety. So they are heavy alcoholic drinkers for a number of years, and they often present to a claim setting when they develop physical complication from alcohol. Then we realize they actually have a undiagnosed or untreated PTSD since two decades ago, for example. So it can delay, you know, many different ways and many different duration, but it's very important that there's a good history taking to explain why the delay occur and why that is the case, to explain that the PTSD doesn't come out from thin air. There's a continuation of suffering from the beginning, but it's just has been able to cover up or minimize because of the person's maladaptive coping strategy.
Mm-hmm. Right. So it's a very complex disorder, and
yes, it is. Very complex.
It has a lot of impact on claim outcomes. Obviously, that's where you come in, and your expert advice is invaluable in helping to determine the outcome of a claim. So thank you, Dr. Chow. Thank you for your contribution. Thank you for sharing your expertise with us today. And of course, you can be contacted directly for any further information, and of course, booked through the MEDirect platform as well. So thank you for your time today.
Thank you, Sue. You're welcome. Thank you.